Today we will talk about pericardium. Pericardium. At the end of this lecture, the students have to define the pericardium, fibrous and serous, describe the shape, relations, and function of fibrous pericardium, describe pericardial sinuses, either transverse and oblique, and realize their clinical importance. Compare between the nerve supply of fibrous, parietal, and visceral pericardium, and comment on the referred pain from pericardium. And finally, recognize the relevant clinical problems, for example, pericarditis, pericardial effusion, and cardiac tamponade. What is pericardium? Pericardium is fibroserous sac surrounding the heart and the beginning of the great vessels. Its function is to restrict the excessive movement of the heart and to serve as a lubricated container in which the different parts of the heart can contract. The pericardium consists of two layers: a tough external layer, which is called fibrous pericardium, and an internal layer called serous membrane, formed of serous membrane called serous pericardium. It has also two layers: outer parietal, which is adherent to the fibrous pericardium, and inner visceral, which is adherent to the wall of the pericardium. Concerning pericardium, is the opposite to the heart. The heart has an apex directed downward and base directed upward, while the pericardium is the opposite. It has a base directed downward and an apex directed upward. What about fibrous pericardium? Fibrous pericardium. Superiorly, its apex surrounds the pulmonary trunk, ascending aorta, and superior vena cava, fusing with rare adventitium. While inferiorly, the base rests on the diaphragm, fusing with its central tendon. The diaphragm separates it from the liver and fundus of the stomach. The base is pierced by on the right side by the inferior vena cava. Laterally on each side, there is phrenic nerve, pericardiophrenic vessels, and mediastinal pleura and mediastinal surface of both lungs. Anteriorly, it's related to the body of the sternum, connected to the body of the sternum by two ligaments, superior and inferior sternopericardial ligament. It's related also to both lungs and pleura, except at an area called bare area of pericardium. What is bare area of the pericardium? It's behind the lower left part of the sternum, between it and the external end of fourth and fifth intercostal spaces. In this area, the pericardium is only covered by thoracic wall. There is no pleura or lung, as the pleura is deviating to the left side or deviating laterally. This is the reflected part. This is reflected area is the fibrous pericardium, while the visceral pericardium is adherent to the wall of the heart, as we mentioned. Relation of the pericardium, it is related posteriorly to the thoracic vertebrae from T4 to T8, separated from the vertebrae by the two main bronchi, descending thoracic aorta, esophagus, esophageal plexus of nerves, and on each side there is the phrenic nerves. The slide showing the posterior relations and lateral relations of the pericardium, and the bare area. In the other figure, the bare area of the pericardium. It has a clinical application we will talk about at the end of the lecture. The pericardium has what is called sinuses. What is the sinuses? Sinus is a recess between the visceral and the parietal layers of the serous pericardium. The pericardium has two sinuses, transverse pericardial sinus and oblique pericardial sinus. Transverse pericardial sinus, uh, as we see in the figure, it is the recess of the pericardial cavity between the ascending aorta and pulmonary trunk, anterior wall, and the superior vena cava and the two atria. This is the posterior wall. Formation of transverse sinus. The ascending aorta and pulmonary trunk are surrounded by a single sheath of visceral pericardium, as they developed from a single tube called truncus arteriosus. From their anterior surface, the visceral pericardium is reflected superiorly on the fibrous pericardium as a parietal layer of serous pericardium, and from their posterior surface, the visceral pericardium passes upward and backward till the upper border of the heart, the upper border of two atria, then reflected downward on the anterior surface of the two atria till the root of the ascending aorta and pulmonary trunk, thus forming transverse sinus. To demonstrate the transverse sinus as we see in the figure, put your finger in the interval anterior to the superior vena cava and posterior to the ascending aorta and pulmonary trunk. This interval is a recess named as transverse sinus. What is the function of this sinus? The transverse sinus gives a space for the distension of ascending aorta and pulmonary trunk during increased cardiac output, and the distension of the right atrium during atrial filling. The pericardium has another sinus called oblique sinus. What is the boundaries of oblique sinus? Superiorly, the oblique sinus is closed by reflection of visceral pericardium from the back of the left atrium to the fibrous pericardium at the parietal layer of serous pericardium. The oblique sinus allows distension of left atrium during cardiac input, while inferiorly it is opened. On each side there is pulmonary veins, and additionally on the right side there is inferior vena. This is the oblique sinus. Again, boundaries: superiorly reflection of the visceral pericardium to form the parietal pericardium. Inferiorly, it is opened, and on each side there is pulmonary veins, and additionally on the right side there is inferior vena cava. What is the function of pericardium? Pericardium restricts the excessive sudden overfilling of the heart and restricts the excessive movement at the wall, and serves as lubricant container in which the different parts of the heart contract without friction, smoothly contracted. Blood supply of pericardium. The pericardium is supplied by the surrounding vessels, anteriorly pericardiophrenik and musculophrenic arteries, and posteriorly descending thoracic aorta, and drained by a zygous system. These vessels we have discussed in the branch of thoracic wall. About nerve supply of pericardium, fibrous pericardium and a parietal layer of serous pericardium are supplied by somatic nerves, phrenic nerves, so they are sensitive to pain, while the visceral layer of the serous pericardium is supplied by autonomic nerves, vagus and sympathetic trunks. We mentioned that between the visceral and the parietal layer of pericardium there is a thin fluid, thin film of fluid to allow movement or contraction of the heart as a lubricant without friction, while accumulation of fluid in this space called pericardial effusion. Pericardial effusion is so dangerous as it affects the contraction of the heart, and it compresses the heart in a case called cardiac tamponade. To evacuate this fluid by a process called paracentesis. We insert a needle in the bare area of the pericardium to to protect the injury or of the lung or pleura and evacuate this fluid. Pericarditis is an inflammation of the pericardium. Pericarditis is an inflammation of serous pericardium called pericarditis, a roughening of the visceral and parietal layers of serous pericardium by inflammatory exudate produces pericardial friction, uh, which can be heard through a stethoscope clinically. In pericarditis, pericardial fluid may accumulate excessively, which can compress the thin-walled atria and interfere with filling of the heart in diastole. The compression of the heart is called cardiac tamponade, as we mentioned. Excessive pericardial fluid can be aspirated from the pericardial cavity, a process called pericardiocentesis. Pericardiocentesis, in which a needle is introduced to the left of the xiphoid process in an upward and backward direction at angle of 45 degree to the skin of the pericardium, or in the left fifth or sixth intercostal space near the sternum. This means at the bare area or in the bare area of the pericardium. When paracentesis is performed at these sites, the pleura and lung are not damaged because the presence of cardiac notch in this area. This area is called bare area of the pericardium, as we mentioned. Thank you.